Hi everyone, it's Wednesday. Hope you all are doing well as we are forging ahead here in 2021 in this first month. And today I thought I'd touch on a few things, a hodgepodge, if you will, of things that I'd like to share with you today. Don't really have any great insight on the vaccine. It continues to be slowly rolled out, but please be patient. You will get a vaccine and we will see how this hopefully will begin to temper the amount of illness that we're seeing right now. The numbers are still great and mutations are starting to happen, and word on the street with some of the infectious disease folks is this is here to stay, folks. This is likely to be a continual issue, perhaps from year to year, that we will even have to consider doing vaccines on a regular basis. So let's all just take a deep breath and know that from our perspective, the key to all of this is optimizing your health through lifestyle choices that will create health and not sabotage anything from the standpoint of health. I wanted to share one of the things that I've run across recently in terms of what we're doing with our health, and that is just to reiterate keeping melatonin or adding melatonin to your toolkit as far as COVID prevention and COVID treatment is concerned. We're seeing an increase in literature about that. The Cleveland Clinic back in the fall reviewed about 27,000 records of the patients in their COVID clinic. And what they saw was that there was a 20% reduction in positive COVID tests in those patients taking melatonin. And interestingly enough, that number increased to 52% negative testing in African Americans. So there's something about melatonin. We don't think it necessarily has to do with just improving sleep, although sleep is quite important. We believe that melatonin in and of itself has great benefit when it comes to optimizing our immune system. You know, at night, this is when a lot of our just grunt work happens in the body, where we go clean up a lot of things and regenerate and optimize our immune system by taking care of just maintenance work. And melatonin seems to be very vital in that. And we know that as we age, melatonin levels just begin to fall. So perhaps this is one of the reasons youthful folks, younger folks who make a lot of melatonin, have much more resilience where viruses and infectious diseases are concerned, and why perhaps folks in retirement homes have a problem in that melatonin levels are just exceedingly low. Now, it's important when you start melatonin, if you have not already, to start on low doses. One of the side effects that can occur is fairly vivid dreams. The other thing is some people are just very sensitive to it. But start slowly. It is thought that anywhere above 6 milligrams is going to be fairly therapeutic. So start with 1 to 3 milligrams and then work your way up. As I've mentioned before, I started at 3 milligrams years ago, went to 6. That was a little too much for me, went down to 5. That worked for a long time, and now I've been able to increase that up to 20 milligrams. But there's something that's very anti-inflammatory, it's antioxidant, and it also inhibits that cytokine storm, that interleukin 6 that's really very powerful in terms of inflammation and what it can do to the immune system. So melatonin as an adjuvant tool in our toolbox for those of us that are still out there and either have not gotten the vaccine or have not had the illness, and perhaps keep us from getting anything like that. So continue with your vitamin D and your zinc and your vitamin C. We've talked about melatonin, NAD, quercetin, these things. All of these things have really wonderful, supportive, anti-inflammatory benefits. We talked last week a little bit about a chemical compound, an organic compound called spermidine. Kind of a crazy name, yes, we know, but nonetheless, we have placed orders and now we'll be getting a new order in soon this week. If you are interested in its anti-inflammatory processes, perhaps it has some protective benefit for infectious diseases out there. We don't have any specific data on that, but it would certainly seem to follow because of its properties that it would have some benefit. We also know that it increases cardiac function in improving the mitochondrial function in the myocytes, or the muscle cells in the cardiac muscle, as well as the rest of the body. It increases autophagy, so perhaps it has some benefits, just like intermittent fasting does, for improving that ability of our body to take all of our old cellular debris and recycle that. So spermidine looks like it's going to have some real benefits. And last week, of course, we talked about the fact that there are some really interesting studies on hair loss and hair thinning, that it has some benefit there with regards to increasing the anagen, or the growth phase, and decreasing the telogen, or the catagen phase of the hair cycle, which allows hair to become thicker and more volume and longer growth. So that looks very promising. And I've looked at several different types of protocols. There's been some talk about pulse therapy in some of the things that I've been reading, which would include higher dosing of the spermidine supplement initially and then bringing it back down to a maintenance. So the maintenance dose is 2 capsules a day. I thought what I might do is 4 capsules a day for 6 weeks and then drop it back down to 2 capsules. And then if there's any stressful periods, or if anyone has surgery, or if you're trying to heal from something, you might want to increase that dosing for a bit of time and see how that works. I'll be interested to see just feedback from any and all of you who decide to look into this. And just like anything that I recommend for you all, I suggest that you do your own vetting and your reading and look into it for yourself. And if we can be of any help or answer any questions, happy to do that. Lastly, I just wanted to touch base on the fact that much of the shipping that we're seeing with some of our supplements, in particular our med packs, but also in anything that we're having to ship out, we are seeing major delays with some of the products that we've been trying to ship, but mostly particularly the med packs. So if you have any issues with that, please let us know, but know that orders have been placed. They just may be slower getting to you. And for those of you that are placing orders for both med packs and for your hormone therapy, please give us a little more notice. We have always recommended 2 weeks, but it wouldn't hurt to order a month in advance, just to make sure that there's no disruption in any of your program. Again, I hope you all are doing well as we move forward in this new year, and I look forward to continuing to do some of these little vignettes every week and sharing things that I am running across and looking forward to. One of the other things I just wanted to share real quickly is I got, before I close out, I got Dave Asprey's new book, Fast This Way. He does have a program starting on the 25th. If any of you are interested, you might want to purchase the book, and you can sign up and get in his program. That he's doing a fasting challenge that's going to be a 2-week challenge. I have absolutely no interest in this from any financial standpoint. I just wanted to share it because I think it might be something that many of you might want to consider doing. So anyway, until next week, happy Wednesday.